Welcome to part 2 of Respiratory Anatomy. Today we're talking about the muscles of inhalation. Before we get into it, let's talk about muscles in general. There are 3 types of muscles: skeletal, smooth, and cardiac. In a nutshell, skeletal muscles are the muscles that support the skeletal structure and move it around. Smooth muscles are the muscle cells of the organs, and cardiac muscle cells are the muscle cells of the heart. The muscles we are going to talk about today are exclusively skeletal muscles. Every muscle has a place of origin and a place of insertion. For example, the bicep originates near the shoulder joint and inserts just past the elbow joint. A very important thing to understand about muscles is that they always contract toward the point of origin. So, if you place your hand on your bicep and curl your arm up, you'll feel the muscle shorten toward the shoulder, which is the point of origin. Now, many of our muscles exist in antagonistic pairs. This means one muscle does an action and the other muscle undoes the action. We'll keep using the bicep as an example. So we've curled our arm, felt the bicep contract toward its point of origin. Now, to uncurl the arm, we need to contract the antagonist. In this case, it's our tricep here on the back of the arm. Like the bicep, the tricep originates just below the shoulder joint and inserts just beyond the elbow joint. As you extend your arm, you might feel the tricep tighten up toward the shoulder. This is how antagonistic pairs of muscles work to move the body. Now that we've established some of the basics, let's talk about the muscles of inhalation. The following muscles are known as the primary muscles of inhalation because they are directly responsible for the process. We'll start with everyone's favorite and perhaps most misunderstood muscle, the diaphragm. The diaphragm is an unpaired muscle that serves as a barrier between the thoracic cavity and the abdominal cavity. It is much larger than most people think. It is also fairly thin. If you take your hands to the base of your sternum and walk your fingers along the underside of your rib cage all the way to the spine, that is the entire perimeter of your diaphragm. Let's throw some terms in here to get the exact location. The diaphragm originates from that area we just explored, the base of the sternum, known as the xiphoid process, and then along the underside of the cartilage of ribs 7 through 12, all the way to the first 3 vertebrae of the lumbar spine. These are all the origination points for the diaphragm. It then inserts into what is known as the central tendon. If you know anything about tendons, you might think of them as the long rope-like structures, but this one is different. The central tendon is this lighter colored area here in the middle of the diaphragm. So, when we inhale, the rib cage expands in 360 degrees, right? Now that we know a bit more about the diaphragm and that muscles contract toward their point of origin, it makes a bit more sense. As the diaphragm contracts, it presses toward the base of the sternum and the lower ribs, causing the rib cage to flare outward. At rest, the diaphragm is shaped like an upside-down bowl. When it contracts and moves outward, it also moves down as it flattens itself out. It changes the volume of both the thoracic cavity and the abdominal cavity. In the thoracic cavity, the bottom of the lungs are adhered to the diaphragm, similar to the way that a piece of paper is adhered to a glass of water through condensation. When the diaphragm descends, the lungs expand because they're being pulled down and out. This increase in the volume of the lungs is what creates the vacuum that is inhalation. We can talk about that more in another video. On the other end, in the abdominal cavity, the viscera, or the organs of the gut, are being compressed by the descending diaphragm. There are a lot of things in the abdominal cavity, and they need all the space they can get. So when the volume of the cavity is decreased, the belly appears to expand as all these organs compress. This is why you might hear some teachers ask for a low breath or look for expansion in the belly. Abdominal expansion is a passive reaction of a deep breath, meaning there's no abdominal effort needed. The truth is, the diaphragm only descends by a matter of centimeters, so a dramatic visual change in the abdomen is not likely. We could probably sit here and talk about the diaphragm for the rest of the video, but it is not the only primary muscle of inhalation. The next set of muscles we're going to talk about are the intercostals. Costal means rib, and inter indicates between, so the intercostal muscles are the muscles between the ribs. There is an outer layer called the external intercostals and an inner layer called the internal intercostals. Inhalation is facilitated by the outer layer or the external intercostals. Keep in mind that muscles contract toward their point of origin. The external intercostals sit between the ribs, and each one originates from the bottom of the rib directly above it. It then inserts into the top of the rib below. So, when the external intercostals contract, they pull the rib below them up toward the rib above. This contraction is what facilitates the lift of the rib cage during inhalation. The diaphragm and the external intercostals are our primary muscles of inhalation. Now, let's talk briefly about the secondary muscles of inhalation. These muscles are secondary because they are not required for inhalation, but they indirectly elevate the rib cage. The first secondary muscle we'll talk about is the pectoralis minor. This is a paired muscle that originates at ribs 3 through 5 and inserts into the coracoid process of the scapula, which is this bony structure here. A side note, a bony protrusion in the body is referred to as a process. Earlier, I mentioned the xiphoid process, and now the coracoid process. Process refers to the extensions or protrusions from the bones, and it will come up a lot in these sort of talks. Anyway, the main function of this muscle is to draw the scapula down. The next set of muscles are the serratus anterior muscles. These are also paired. They originate on the outer side of the first 8 ribs and insert into the scapula. Their primary job is to protract the scapula, rotate it upward, and stabilize it. On the back body, we have the serratus posterior superior. It originates in several places here along the spine in these ligaments. It then inserts into the upper part of ribs 2 through 5. Its main function is to elevate the upper ribs. Now we're going to move up to the neck and talk about a couple of muscles here. First, we'll talk about these thin muscles here known as the scalenes. They originate on the cervical vertebrae and insert into the first rib and the second rib. These little muscles are responsible for moving the cervical spine laterally or from side to side, and they also elevate the first 2 ribs. Coming around, we have these big muscles that wrap around the side of the neck. This is another paired muscle called the sternocleidomastoid muscle. It's a mouthful, but it makes sense. It originates on the upper part of the sternum, also known as the manubrium, and on the upper part of the clavicle. It inserts at the mastoid process, which is the bony protrusion that you can feel if you put your fingers right behind your ear. From there, you can trace the sternocleidomastoid muscle all the way to the origin points. Now, if this name is confusing or hard to say, think of it this way. It originates at the sternum, sterno, and the clavicle, cleido, and inserts into the mastoid process. The main function of the sternocleidomastoid is to rotate the head, move it laterally, and flex the cervical spine. Like with all the secondary muscles, the involvement in inhalation is minimal, but not entirely absent. For the most part, they all indirectly lift the rib cage. Let's review the important points we've covered today. Muscles have an origin point and an insertion point. Muscles always contract toward the origin point. There are 2 primary muscles of inhalation, the diaphragm and the external intercostals. The diaphragm is a large, flat muscle that moves down and outward, causing the rib cage to expand in 360 degrees. The external intercostals are the outermost muscles between the ribs, and they elevate the ribs, causing the whole rib cage to lift up. There are 5 secondary muscles of inhalation. They are secondary because they indirectly elevate the ribs. Pectoralis minor draws the scapula down. Serratus anterior and serratus posterior move and stabilize the scapula. The scalenes provide lateral movement to the cervical spine, and the sternocleidomastoid muscles rotate and laterally flex the head and flex the cervical spine. Like I mentioned in part 1, if you're looking to keep this information in your head, write it down from memory as often as you can. Reviewing this information right before you go to sleep will give you a better chance of remembering it the next day. Hopefully this was clear and informative. If you have any questions, please leave a comment below and I'll answer it as best I can. If you learned something from this, please like the video and subscribe to the channel for more content like this. I'll see you next time in part 3, Muscles of Exhalation.